Welcome to the Model of Care training on the Safe Birth system of care. The Model of Care program guarantees that care is delivered to patients at the most convenient service layer across the Kingdom of Saudi Arabia. It is comprised of 6 systems of care, which cut across the 6 layers of care, from activated person through to specialized hospital care. The model of care will be delivered through 42 interventions, some of which cut across systems of care, while others are system of care specific. Today's module will focus on the Safe Birth system of care. By the end of this module, you will understand what the model of care interventions for safe birth are, as well as some international best practices for safe birth. Historically, there was poor maternity planning in the kingdom, including inconsistencies in delivery, a high volume of referrals, and lack of clear follow-up for pregnancy cases with chronic conditions. Additionally, there was poor education and awareness on safe birth, in part due to a lack of effective counseling after premarital screening and lack of robust public health education programs. Finally, inconsistencies in OB/GYN skills in primary care centers and high bed occupancy rates in tertiary hospitals led to resource and quality challenges. The Safe Birth system of care will support women have safe delivery and healthy infants by providing continuous support from pre-marriage and preconception to post-delivery. This will be achieved through the implementation of 7 safe birth interventions and 1 cross-cutting intervention, including premarital screening to expand screening to include genetic and infectious diseases and make screening mandatory before marriage. Preconception care services to provide access in primary care centers to support women prepare for a safe pregnancy and healthy baby. Maternity care services to include a wide range of services from initial booking through risk assessment, categorization to delivery, and formalized postnatal care. A national birth registry to improve national newborn registration program to include all health information pertinent to childbirth required for national statistical data. Postnatal care services to conduct medical and clinical examination for mothers and newborns before leaving the hospital and empower mothers through postnatal education programs. Neonatal care services to provide focused newborn screening targeting the most common genetic and non-genetic diseases. Well baby clinics to support patients in raising healthy children by providing a range of services in primary care centers. And enhanced primary care services to better support patients in their community closer to home. Let's look in more details at the premarital screening intervention. Premarital screening will provide comprehensive health counseling in addition to services to detect genetic disorders and reduce infant diseases. The premarital services intervention will increase access to genetic disorder and infectious disease screening by increasing the role of PHCs in counseling, delivering services through community programs, and educating individuals early. Patients will have greater access to premarital services due to the increased number of available screening locations as well as continuity of care. Patients will be able to get screened, follow up on diagnoses, and receive counseling at the PHC per national guidelines. This intervention will also introduce preconception education, such as healthy lifestyle, diet, and risk and mitigation measures. Genetic counseling and education for those undergoing premarital screening, particularly high school students, is critical to becoming knowledgeable about outcomes and limitations of potential marriages. In coordination with the Ministry of Education, education on genetic disorders, infectious diseases, and outcomes on reproductive and child health should be introduced into curriculums to better equip individuals to make educated decisions about their health and future. Premarital screening intervention will fulfill its objectives by enabling early diagnosis of genetic disorders, ensuring that couples receive comprehensive health counseling early on, and by reducing the number of babies born with inherited and congenital diseases. To fulfill its mandate, premarital screening relies on educating and training clinical staff in primary care, including GPs, nurses, nurse practitioners, and midwives. as well as on the proper technology to enable electronic access to health records, and on the incorporation of premarital education and screening in school curriculum and activities. Finally, the premarital screening intervention also relies on regulatory enablers, such as organizations to support families with chronic diseases, family planning services, and a national committee for genetic screening. Now, let's turn our attention to the preconception care services intervention. Preconception care services involve readying and supporting women through safe delivery, educating them for self-care, and promoting a healthy lifestyle. Women planning to conceive will have a single point of contact in PHCs that will provide them counseling on necessary preconception preparation and will conduct an individual risk assessment. Based on the risk assessment results, care will be provided in PHCs for low-risk patients, while high-risk patients will be referred to secondary and tertiary hospitals. Preconception care services in primary care will prepare women for a safe journey through pregnancy and the delivery of a healthy baby, and will encompass educating women and readying them for a safe pregnancy by increasing their awareness on lifestyle, diet, vaccination, risk, and mitigation measures. Preconception care will be supported by centralized regional reference laboratories for performing rare and complicated tests, as well as by local labs for more simple routine tests. Additionally, awareness activities will be conducted in the community and will encompass lifestyle, nutrition, pregnancy expectations, and employment. In addition, counseling will address infectious diseases, family planning and pregnancy spacing, oral health, environmental hazards, and genetic disorders. Preconception care services will fulfill their objectives by improving general health and promoting a healthy lifestyle in preparation for pregnancy, by providing early access for women to be involved in their care plans from early pregnancy, by supporting families who are at risk of having a baby with a congenital abnormality, and by promoting the health advantages of breastfeeding for women and their babies. To fulfill their mandate, preconception care services will rely on trained clinical staff in primary care, including GPs, nurses, and nurse practitioners, as well as midwives, and will also rely on electronic access to health records. Let's now look at the maternity care services intervention. Maternity care services will support women throughout pregnancy and offer numerous services intended to produce a healthy outcome for both mother and child. Pregnant women's first point of contact will be with a midwife that will test and confirm the pregnancy as well as estimate a delivery date. From there, women will go through booking, which includes an assessment of past medical history, family history, as well as the results of premarital or preconception tests. Following the risk assessment, pregnant women will be categorized as low risk or high risk. And low risk women will receive maternity services in primary care center led by a midwife throughout their pregnancy. For high risk cases, women will be referred to secondary or tertiary care based on the national guidelines and will have a pregnancy coordinator to organize the outpatient appointments and readiness for emergencies. Finally, primary care centers will be supported by an urgent maternity transport system, including ex utero transport. And mothers will be empowered through education programs and access to relevant information. Maternity care services will fulfill their objectives by supporting women throughout their pregnancies, providing early access to maternity services, increasing the share of antenatal bookings by 12 weeks of pregnancy, providing a national risk assessment tool for antenatal care, establishing a national antenatal care pathway for low-risk and high-risk women and their babies, by establishing a national antenatal screening service, providing education and information on maternal care, ensuring only high-risk cases are seen in tertiary healthcare settings, by increasing utilization of midwives for low-risk pregnancies, and by increasing the breastfeeding rates. To fulfill their mandate, maternity care services rely on trained clinical staff, including GPs, nurse practitioners, and midwives in primary healthcare centers. It also relies on the regulation of midwives, as well as on virtual tools to provide patients with educational materials. And finally, on the technology required to provide electronic access to health records. Let's look in more details at the National Birth Registry intervention. The National Birth Registry will generate and collect data pertinent to childbirth for future health improvement programs. The existing National Newborn Registration Program will be improved to include all health information pertinent to childbirth required for national statistical data, such as mode of delivery, week of gestation at birth, birth weight, APGAR score, breastfeeding status, in addition to the newborn imprint for security measure. The National Birth Registry will fulfill its objectives by collecting additional statistics on comorbidities and by helping inform future interventions and health improvement programs. To fulfill its mandate, the National Birth Registry will rely on administrators and PHCs trained on the new requirements, on electronic access to health records, on linkage to electronic birth registry data, and finally, on collaboration of each cluster with the Ministry of Interior to develop a committee to enhance the National Birth Registry process and system. Let's turn our attention to the postnatal care services intervention. Postnatal care services will be provided across 4 service layers, from the home to primary care centers and secondary and tertiary hospitals, depending on the care required by the patient. Primary care centers will conduct medical and clinical examinations for mothers and newborns, including newborn screening. PHCs will also empower mothers through a range of postnatal education programs, including on mother and baby wellness, vaccination, breastfeeding, and infant nutrition. Secondary and tertiary hospitals will focus on infants who require specialist or multidisciplinary care or frequent monitoring, and will provide immediate care after birth as needed based on the mother and child condition. Where required, in-clinic follow-up or home visits by trained health providers can be arranged through primary care centers. This program will be supported by clear guidelines and referral criteria between providers. Finally, postnatal care services will also include the development of a national program to protect newborns from abduction, such as security bracelets. Postnatal care services will fulfill their objectives by standardizing postnatal care services, providing education to mothers on maternal and child care, coordinating of services across service layers, improving initiation and sustained breastfeeding rates, and improving early detection and access to perinatal mental health services. To fulfill their mandate, postnatal care services will rely on educated and trained clinical staff, including specialists, GPs, nurses and nurse practitioners, as well as midwives. On specialized trainings for midwives, including on family planning counseling, home visits, and on how to provide up to 6 weeks of postnatal checks for low-risk women and infants. It also relies on mental health assessment training, including for postnatal depression and puerperal psychosis, amongst others. And finally, this intervention will also rely on electronic access to health records, referral network, case coordination, and birth registry. Now, let's look at the neonatal care services intervention. Neonatal care services will be standardized to better address health concerns and outcomes of newborns, and will include a comprehensive newborn assessment that targets the most common genetic disorders in the country, as well as non-genetic diseases. Through this assessment, newborns will be categorized into the 4 NICU levels of care and the appropriate care settings. Level 1 newborns will be cared for in a well-new baby nursery in primary health centers, with a range of staff including pediatricians, nurse practitioners, and other advanced practice registered nurses. Level 2 newborns will be cared for within a special care nursery in a general hospital by pediatric hospitalists, neonatologists, or neonatal nurse practitioners. Level 3 newborns will be referred to an NICU within a specialized care facility, capable of providing life support and access to a full range of pediatric medical subspecialists, pediatric surgical specialists, pediatric anesthesiologists, and pediatric ophthalmologists. Finally, Level 4 newborns will be referred to a regional NICU located within an institution with the capability to provide surgical repair of complex congenital or acquired conditions, and with a full range of pediatric medical subspecialists, pediatric surgical subspecialists, and pediatric anesthesiologists on site. Neonatal care services will be supported by the National Referral Network to determine the most appropriate location for patient care, as well as by the Resource Control Center to ensure safe and effective transport by a rapid response team and the availability of required neonatology consultants and other specialties. Neonatal care services will fulfill their objectives by enhancing and coordinating access to various services across hospitals, by increasing safety and quality of NICU services, as well as by collecting better incidence data on genetic and non-genetic diseases, by improving outcomes for premature and sick babies, by improving the utilization of resources, and by standardizing universal neonatal screening for all newborns. To fulfill their mandate, neonatal care services will rely on trained clinical staff, including specialists, general practitioners, nurses, and nurse practitioners, as well as on case coordinators that will support patients maneuver through the complex health system. It also relies on national guidelines on when and where newborns should be vaccinated, and on a newborn screening program that is linked to premarital and antenatal screening programs. It also relies on a national referral network to enhance coordination, especially to ease the transfer of high-risk cases, and on the full implementation of a national birth registry to collect appropriate statistics. Finally, the intervention also relies on a dedicated transport and neonatal retrieval teams by cluster, as well as on electronic access to health records, referral network, case coordination, and birth registry. Let's take a closer look at the Well Baby Clinic intervention. Well Baby clinics will be established in primary health centers across the country to support child health and development by detecting and intervening on abnormalities and by proactively addressing children's needs. These clinics will provide a range of services, including immunization as per the National Immunization Schedule, screening of vision, hearing, blood pressure, language, and development, discussion with parents about their child's developments, both how they can support it as well as any concerns they may have, screening for parental morbidities such as mental health problems, abuse, substance misuse, or physical illness, promotion of early literacy activities such as reading, speaking, and singing to babies for every family, and information about community-based early childhood development resources for every family, including parenting programs, parent and early learning resource centers, libraries, and recreational and community centers. Children under the age of 5 should visit Well Baby clinics following set intervals, starting at 2 weeks old, and should then come for subsequent visits at 2, 4, 6, 9, 12, 15, and 18 months, and then should come for yearly visits after the age of 2. Well Baby clinics will fulfill their objectives through the early detection and interventions for abnormalities, through monitoring of the baby's growth and development, as well as providing parenting guidance and support, by detecting child abuse and neglect, increasing breastfeeding rates, and encouraging weaning at 6 months old. To fulfill their mandate, Well Baby clinics will rely on training for nurses and general practitioners, as well as on a national referral network to be able to refer the patients in need of additional care. They also rely on national guidelines to develop the national standards for these services, as well as on primary healthcare centers being enhanced to provide these services. It also relies on electronic health records so data can be recorded and accessed when needed. And finally, Well Baby clinics will rely on advocacy for these services to be provided in all primary health centers within the cluster. Finally, let's focus on the Enhanced Primary Care Services intervention. The Enhanced Primary Care Services intervention ensures that patients have access to primary care services through primary care centers or through mobile clinics to improve outreach in the community. Primary care services will be a patient's first point of contact with a physician closer to home and will be expanded to include a wide range of services, including chronic care, urgent care, end of life, prenatal, maternity, and postnatal care, screening, well baby, mobile clinics, minute clinics, and other specialized support services. To fulfill its mandate, the Enhanced Primary Care Services will rely on developing guidelines and raising public awareness to promote the use of primary care services. On enhancing the integration of primary care facilities with other healthcare facilities by effectively implementing case coordinators, developing integrated personal health records, and by establishing data collection and quality monitoring. It also relies on enhancing the infrastructure of primary care centers. And finally, it relies on developing the necessary workforce through recruitment and training to establish multidisciplinary teams and increasing exposure of medical students to primary care centers. Premarital screenings are frequent in Arab, Mediterranean, and South Asian countries, and have demonstrated strong impact in countries where they have been implemented. In Turkey, mandatory premarital screenings led to the cancellation of more than half at-risk marriages and reduced at-risk birth by 80%, while in Bahrain, close to 60% of at-risk marriages were canceled. In the Kingdom of Saudi Arabia, following the implementation of mandatory premarital screening, the prevalence of beta thalassemia dropped from 33% to 9%, and the number of at-risk couples dropped by 60%. In the United States, womenshealth.gov provides recommendations on 3 key areas. First, on the importance of preconception health. The website advocates a pregnancy plan to control the risk of preterm birth and low birth weight babies, and the necessity to act on health issues and risks before pregnancy to prevent problems that might affect the mother or the baby later. Second, the website provides recommendation on the improvement of preconception health, advocating for a healthy lifestyle, covering aspects like diet, smoking, body weight, and medicine, on the consumption of 0.4 to 0.8 grams of folic acid per day, the control of any medical conditions, and the need to avoid contact with toxic materials. And third, the website advocates consulting a specialist and discussing family health problems, such as issues with prior pregnancies and family concerns that might affect the pregnancy. In the United Kingdom, the Better Birth Vision aims to transform maternity care services across the country by strengthening the local maternity systems. The initiative focuses on providing women access to information and support centered on their individual needs and preferences. Providers and commissioners of maternity services formed an integrated local maternity system, or LMS, established across 44 geographies within the United Kingdom, with leadership and governance to transform services. These local maternity systems build services around the community hub model to provide a one-stop shop and faster referral services. The community hubs provide diagnosis, obstetric services, primary care services, home birth, community midwives, health visitors, social services, and parent groups. In the United States, the National Center for Health Statistics is responsible for developing specifications for certificates of live birth and reports of fetal death. It publishes detailed specifications for the collection and reporting of items on the birth certificate, and all data are entered and stored electronically. Key data points revolve around child, father, and mother details, and medical and health informational details like the risk factor in pregnancy, onset of labor, method of delivery, and other details, including those for the newborn, like APGAR score, abnormal conditions, and congenital anomalies. In the United Kingdom, the Healthy Child Program of screening tests, immunizations, developmental review, and health education supports parenting and healthy choices for infants between the ages of 0 and 5. A core component of the program are the Health and Development Reviews, which assess infant development, detect abnormalities, evaluate family risks and needs, and give parents an opportunity to discuss concerns. In Switzerland, newborns are immediately segmented into 4 classifications based on the level of care required. The standardized segmentation provides care providers with a clear scope of work and allows for degrees of subspecialization. For example, facilities that treat level 4 newborns in the NICU have increased exposure to high-needs neonates and can better care for similar cases due to repeated exposure to such cases. The standard approach to care is focused on a number of goals, including improving health outcomes, promoting the transfer of patients and optimizing patient care, on ensuring optimal use of financial and human resources, and on improving training. In the United Kingdom, the Healthy Child Program is an e-learning program for all healthcare professionals working with pregnancy in the first 5 years of life. The program covers a wide range of topics related to child health and health promotion. It consists of 76 learning sessions, which are suitable for a range of health workers and can be delivered as a package for clinicians undergoing training or individually to clinicians wishing to update certain skills. These sessions can be completed in 20 to 30 minutes each and are thus feasible to fit around a busy clinician schedule. Since 2000 in Canada, midwives in primary care settings assist women in childbirth and provide a wide range of services, from ordering tests and prescribing medication to attending birth as the primary attendant or providing referrals to the appropriate resources. International benchmarks such as Canada, Switzerland, the United States, and other countries were selected to inspire the thinking to shape the implementation of safe birth initiatives in your clusters, to ensure patients across the kingdom are screened for genetic and infectious diseases, and that mothers and children across the kingdom have easy access to a range of necessary services at all stages of pregnancy and of the child's life. This concludes the module on the Safe Birth System of Care. You should now have an understanding of the scope and objectives of this system of care and its interventions. Thank you for watching.